Hello, my name is Dan Partain and I'm a consultant here at the Center for Palliative Medicine and Mayo Clinic in Rochester. I'm delighted to have the opportunity to talk a little bit about our original article today. It's called The End of Life Care for Seriously Ill International Patients at a Global Destination Medical Center. I would like to take this opportunity to thank my co-authors, including Dr. Elise Carey and Dr. Jacob Strand here at Mayo Clinic, as well as my collaborating co-authors, Dr. Justin Sanders and Dr. Ricky Leiter from the Dana-Farber Cancer Institute in Boston, Massachusetts, for their tireless effort in helping us complete this study. So, why did we do this study in the first place? At least 70,000 international patients come to the United States each year for medical care. Most are coming for advanced cancer or surgical treatments. This number is only expected to increase as U.S. hospitals actively recruit international patients for a variety of reasons. Moreover, advanced surgical treatments and oncologic care like immunotherapy attract ever-growing numbers of patients. Although some research has been done into disparities for end-of-life care for religious and ethnic minority populations in the United States, very little is known about the end-of-life care for seriously ill patients coming from international settings. We undertook this study to review the end-of-life care for all international patients that died at a major tertiary medical center from January 1st, 2005 to December 31st, 2015. Our study cohort included patients from 25 countries and 5 continents. The top region of origin was the Middle East, the top language spoken was Arabic, and the top religious preference was Islam. We had patients from around the world, including North America, South America, and Europe. Our cohort of seriously ill international patients spent an average of 19.5 days in the hospital over the last 3 months of their life, and 61% of these patients died in the intensive care unit. 26% of these patients had a social work referral to attempt repatriation a median of 7 days before death. So what does this all mean? Well, our study found significantly different rates of advanced directive completion in our seriously ill international patients. Our patients completed an advanced directive only 11% of the time, while U.S. patients older than age 60 generally complete advanced directives 72% of the time. I think this highlights the fact that we don't really know that much about the healthcare preferences and values of our international patients, and there is much work left to be done in this area. We know that U.S. patients consider many factors to be important near the end of life, including avoiding uncomfortable symptoms, maintaining autonomy, and adhering to beliefs about death and the afterlife. Although previous authors have suggested that international patients may have the same beliefs, we would suggest that we really don't know until we ask our patients. I think this study provides a key first step in understanding the end-of-life experience for seriously ill international patients and helps illuminate the way forward in this area of need. Particularly given the growing numbers of patients expected to come to the United States for advanced medical care, I think further research is needed to understand the goals, preferences, and values of these patients and to help us identify implementable solutions for overcoming the unique barriers to high-quality end-of-life care.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.